On April 30th, 2020, TSBDE released Emergency Rule 108.7, which is in effect from May 1st, 2020 through the end of August. In order for dental healthcare providers to expand beyond urgent and emergent care, they must be compliant with the policies outlined in Emergency Rule 108.7. A number of changes have been made for the COVID-19 pandemic. High-level changes are outlined on this slide. Before the patient arrives, it is the dental healthcare provider's responsibility to assure that the patient is not exhibiting any COVID-19 symptoms. In addition, if any dental healthcare provider is not feeling well, he or she should stay home. Within the waiting room, prior to the patient's arrival, items like books, magazines, and toys should be removed. In addition, wherever possible, furniture should be moved or removed to support social distancing. Upon arrival to the clinic, dental healthcare providers and patients should be screened and have a temperature check. Prior to the procedure, the patient should perform a pre-procedure mouth rinse. We are using 1.5% hydrogen peroxide. Hydrogen peroxide comes in 3%, so we are diluting this 50-50 with water. During treatment, the dental healthcare providers must make every effort to minimize generation of aerosols. This might mean doing things like using hand instruments or cotton pellets to wet and dry inside of a preparation. Wherever possible, dental isolation must be used. Good suction via high volume evacuation is necessary. In addition, appropriate personal protective equipment is mandatory. After treatment, the patient needs to be informed to contact the clinic if he or she develops symptoms consistent with COVID-19 in the 14 days after the treatment. At the end of the day, when the providers are done performing treatment, they must carefully remove or doff their personal protective equipment without cross-contaminating themselves. In addition, TSBDE states that all dental healthcare providers should change clothes before returning home. So why all the fuss? We're dental healthcare providers and we're used to wearing PPE. We're used to disinfecting and sterilizing. Well, this virus is an emerging virus and we're learning more and more about it as the days go on. In order for us to make sure that we protect you and our patients, we are erring on the side of caution.